I can describe midwifery in few words that really matters to me. Midwifery actually is about compassion, and the midwife is compassionate. It's a holistic health care. She is part of the team and loving and caring.
To describe midwives, I can say they are the primary caregiver for normal birth. They may have an important role in saving lives.
To describe midwives in 5 words, midwives provide support, care, encouragement, and advice for mother. So, investment in midwifery is very important to prevent the occurrence of maternal and child death.
So I've been asked to describe midwifery in 5 words. It's the most difficult thing to describe someone so beautiful to describe in 5 words, but my go-to 5 words are passionate, considerate, natural or physiological birth believer, an advocate, and someone who is very kind. Like when I think of a midwife.
The etymology of midwife translates it to be with women. But in reality, these trained health professionals are in charge of baby, mother, and her family simultaneously. Active listening, empathy, problem solving with counseling skills, using motivational tools is part of their job. So providing not only physical, emotional, and psychological support to patient, but at the same time being an effective commune with obstetrician. A midwife's journey of patience, dedication, and compassion goes from antenatal counseling to intrapartum care and ends with postpartum follow-up.
Mother and newborn need multidisciplinary care. So doctors, midwives, and nurses work in collaboration to provide the optimal care for mothers and their babies. For me, as a neonatologist taking care of newborn babies, midwives are playing an important role. They are monitoring babies in utero to be sure everything is going right during giving birth. They provide early intervention if the baby needs any help to breathe soon after birth, because they are also well trained to start neonatal resuscitation. In addition, midwives normally take care of infants throughout the first month of life, so they can early detect and refer the infant to the doctor if any medical concern.
Well, I work all the time with midwife, and I work in the birth and something that's related to maternal health. So definitely, as a lactation consultant, I would really like to have the help of a midwife before giving birth, during pregnancy, and during birth and postpartum. Midwife is an essential part of my plan and the mom's goal.
Ideally, all maternity units should be run under consultant care. However, when I was raised and trained in UK back in 1990s, I had really a very nice experience with work there, where they got something called community midwifery. And this community midwifery are highly qualified midwives. They can look after low-risk pregnant ladies during the antenatal period and also while giving the child birth, and they go and visit them at home back postnatally. This system is really nice because those women who's low risk and they choose to have natural birth without augmentation or anything, ideally midwife care is really good for them. And I hope here in Saudi Arabia we adopt this system. It's very important.
Working more than 22 years with them, I found effective interpersonal communication between midwife and obstetrician to be the hallmark of patient care. Being primary caregiver, they have great responsibility, and it has been observed that well-trained midwives could help avert many maternal and neonatal deaths.
The collaboration with midwives is very supportive because they are working as advocates for breastfeeding. They are doing an excellent job in antenatal education and preparation of mothers, not only for natural birth but also for breastfeeding. They encourage skin-to-skin contact of babies with mothers soon after birth and early start of breastfeeding within the first hour of life, in addition to promotion and support of continuity of successful breastfeeding.
It's very mandatory and important that the midwife, they should know their limitation, and when they need help, they can call or refer the patient to a specialist or a consultant unit in order to have a safe maternity practice. Thank you very much.
First thing, and the most important thing, that we should understand that we are a team and not competitors, and we are amazing, and we can actually do amazing things together. We can refer the moms to who she needs in this specialty, and also by the education that the midwife provides to the mom, and by the help, she can actually come to the lactation consultant later on if there is a bigger problem. So we can actually prevent a lot of problems in breastfeeding while having a midwife that actually qualified, and she can help the mom to achieve.
To work in collaboration with midwives, it is very important to work with midwives during antenatal care and postpartum after visiting the clinic in the primary health care center for further advice, support, evaluation of the mother and of the baby from different point of views, like the nutritional status of the baby, the general health of the mother.
They are indeed the eyes and hands of obstetrician in the labor room. Much respect and best wishes to all the midwives doing a great job all around the world.
Of course, they are the biggest supporters of the birth that a mum and a dad wants, but while they are focused on the medical skills that a doula may not have, the emotional aspect, the physical aspect, the stress aspect can be covered by a doula. So this is how midwives and doulas can work together to make things better for both the mum and the baby. I think it would be a huge difference. Both midwives and doulas can make impeccable impact on the birthing outcome if they come together. So having said that, I would love to say Happy International Day of Midwife, and kudos to all midwives that's doing their amazing.